Bismillahirrahmanirrahim. My dear students of AWMC 9, Assalamu alaikum. I am going to discuss about the basic facts of blood pressure. Blood pressure is lateral pressure exerted by the flowing blood on vessel wall. It depends on cardiac output and total peripheral resistance. Cardiac output is the amount of blood ejected by heart per minute, and total peripheral resistance is the arterial is the site of total peripheral resistance. When both the facts will increase, it will increase blood pressure. Or if any one of them when increases, it will increase blood pressure. Now, determinants of cardiac output. Cardiac output is the amount of blood ejected by heart per minute and is dependent on stroke volume and heart rate. Stroke volume is the amount of blood ejected by heart per beat, and heart rate is beat per minute. When either stroke volume or heart rate increases, then cardiac output will be increases. So now the determinants of cardiac output. It depends on the force of myocardial contractility and also depends on venous return. Force of cardiac contractility is dependent on strength and integrity of the muscle fiber. It also depends on ions. Calcium and sodium increase contractility, while potassium and magnesium decreases contractility. And blood volume, it depends on amount of blood, volume of blood, as well as it depends on venous tone. So, and regarding peripheral resistance, arterial is the site of peripheral resistance. There are some there are some facts which regulates on total peripheral resistance. Number one is autonomic control, and it is the parasympathetic system which controls the peripheral resistance, but there is no control of parasympathetic system. There is no innervation of parasympathetic system on the arterioles. So, at circulatory pressure amine like noradrenaline, adrenaline, and dopamine, they increase blood pressure. Angiotensin 2 increases blood pressure by causing vasoconstriction. On the other hand, prostaglandin, bradykinin, and nitric oxide, they causes vasodilation, decreases total peripheral resistance, and causing fall of blood pressure. So these are the facts we have to keep in mind while understanding the blood pressure mechanism. Now, the regulation of blood pressure, there are three important organs is involved. There is heart, one vein is heart, then the blood vessels, then kidney. In heart, there is autonomic control is very important. Sympathetic control as well as parasympathetic control. Parasympathetic decreases heart, but sympathetic system increases heart. Parasympathetic system, though it is more powerful on heart, but it does not completely supply the heart. While sympathetic system, it completely covers the heart, and it increases all the parameters of the heart except refractory period of AV node. And on blood vessel, sympathetic system causes vasoconstriction, increases total peripheral resistance, and contributing rise of blood pressure. While parasympathetic system, it has got no innervation on venous side or arterial side, but there are receptors, cholinergic receptors are there, and acetylcholine causes fall of blood pressure by dilating peripheral vascular arterioles. And so the blood, at the same time, other factors like angiotensin, it also causes vasoconstriction and rises total peripheral resistance. And bradykinin, monoamine, that nitric oxide also causes fall of blood pressure. Now, in kidney, there is important system, renin, angiotensin, aldosterone mechanism. In any cause, when there is renal anoxia, there is release of renin, which acts on angiotensinogen and converts it to angiotensin 1. which will be converted to angiotensin 2 by angiotensin converting enzyme. This angiotensin 2 has got three important effects. One is it is a powerful vasoconstrictor, rising pleural peripheral resistance, contributing rise of blood pressure. And it has got powerful effect in releasing aldosterone from Zola glomerulosa. This aldosterone causes tubular reabsorption of sodium along with water, increasing blood volume, thereby increases venous return, stroke volume, and rise of blood pressure. And it has also, angiotensin 2 also causes release of adrenaline from adrenal medulla, which acts on heart and blood vessel, alpha and beta receptor respectively, contributing rise of blood pressure. So this renin, angiotensin, aldosterone system all will participate to rise of blood pressure. On the other hand, there is another system, kininogen, bradykinin, kallikrein and bradykinin system. They will cause fall of blood pressure. Kininogen converted to bradykinin by kallikrein. This bradykinin directly causes vasodilatation and causing decrease in pleural resistance and falling blood pressure. Also bradykinin by releasing prostaglandin causes fall of blood pressure. And this conversion of angiotensin 1 to 2 and the bradykinin metabolism is regulated by kinase 2 enzyme or angiotensin converting enzyme. So there are two span, one regulating rise of blood pressure, one regulating fall of blood pressure. And another important thing is baroreceptor mechanism. When there is change of posture, moment to moment adjustment of blood pressure occurs. When a man is on supine position, from just stand up, and due to gravity, blood pressure, blood pooling in the dependent parts, but still we don't feel any hypotensive attack. This is because of the sympathetic system regulated in the medulla of the neurons of the vasomotor center of medulla will control it, maintaining blood pressure by activating sympathetic system. This is the basic facts of regulating blood pressure. Now, hypertension. Hypertension, where the elevated blood pressure, consistently raised blood pressure from normal for adult of different size. It is consistent rise of blood pressure more than abnormal is considered as hypertension. And this hypertension usually primary or idiopathic, may be secondary due to some cause. Idiopathic hypertension, here the cause is one cause, is the main cause, that is still to be investigated. While secondary causes are maybe due to renal cause, maybe glomerulonephritis, pyelonephritis, renal vascular disease, polycystic disease of the kidney. Then endocrine cause, maybe acromegaly, thyrotoxicosis, pheochromocytoma, Cushing's syndrome, primary hyperthyroidism, hyperparathyroidism, primary hypothyroidism. Regarding drug cause, drugs, steroids, oral contraceptives, then sympathomimetic drugs, NSAID, and then pregnancy, diet, alcohol, obesity, and pregnancy, toxemia of pregnancy, they are the secondary causes of hypertension. Now, drug therapy of hypertension. As we know, that sympathetic system mostly regulates blood pressure. So, we have to use anti-sympathetic drugs for regulating blood pressure. Parasympathetic system also involved in the blood pressure control, in regulation of blood pressure, especially on cardiac side. But we can use parasympathomimetic drugs to decrease blood pressure, but we are not using parasympathomimetic drugs to decrease blood pressure because parasympathetic system is very vital for the body. That's why we want to least disturb parasympathetic system. That's why we use sympatholytic drugs for regulating to reduce blood pressure. Now, one thing, there is two terms. One is anti-hypertensive drugs and one is hypotensive drugs. Anti-hypertensive drugs means they will decrease elevated blood pressure, and hypotensive drug means they will decrease blood pressure irrespective of its site. Anti-hypertensive drugs we use classical antihypertensive drugs we use clinically, but in case of hypotensive drug, like vasodilators, we use during emergency. Now, classification of antihypertensive drugs are, it can be classified according to this way. There is sympatholytics. Under its banner, there will be central sympatholytics like alpha-methyl dopa and clonidine, and there may be peripheral sympatholytics. These can be classified again as receptor blockers: alpha blocker, beta blocker, alpha beta blocker, then ganglion blocker, then neuron blocker. These are alpha blocker like tyrosine, beta blocker like atenolol, then alpha beta blocker like labetalol, then ganglion blocker mecamylamine, then neuron blocker guanethidine. This belongs to alpha adrenergic and sympatholytic drugs. Now, ACEI and ARB. AC, angiotensin converting enzyme inhibitors, captopril, lisinopril, and ARB, angiotensin receptor blockers, losartan, valsartan. These drugs can be used. Then calcium CCB, calcium channel blockers. These groups can be classified into three groups: dihydropyridine group, phenylalkyl amine group, benzothiazepine group. For antihypertensive purpose, we use mostly dihydropyridine group, and they are vasoselective calcium channel blockers, mostly used for antihypertensive purpose. Cardioselective CCB drugs are mostly used for antiarrhythmic purpose. Another group is diuretics. This diuretic family, there are several drugs like thiazide, like furosemide, like amiloride. Furosemide, thiazide, mostly used as antihypertensive drug. Thiazide, though belongs to diuretic family, but it is considered as classical antihypertensive drugs for the elderly. For mild and moderate hypertension, we use thiazide. But for severe hypertension, we can use furosemide during emergency or in severe hypertension. And amiloride, this drug is used along with either thiazide or furosemide to counter hypokalemia. Then there are vasodilators. Vasodilators like hydralazine, minoxidil, sodium nitroprusside, and diazoxide. Another group is renin antagonist, aliskiren. These are the classification. These are the drugs used. These are the antihypertensive drugs. But for practical purpose, for clinical purpose, we can classify antihypertensive drugs alphabetically, like A, B, C, and D. A stands for ACEI and ARB, means angiotensin converting enzyme inhibitors, and ARB means angiotensin receptor blocker. B stands for beta blocker. Here cardioselective beta blockers are considered. Cardioselective beta blockers are considered in this group. Then CCB, here vasoselective CCB drugs like amlodipine, nifedipine, considered as antihypertensive. And D is diuretics. diuretics, classical diuretics used for antihypertensive purpose is thiazide. Now we discuss about about A group and ACEI. These drugs next program will be discussed on later on, inshallah. Thank you for your patient hearing. Assalamu alaikum wa rahmatullah.